Hi, Carolyn. It's nice of you to join me today. I appreciate your time. Um, we're really looking at how people can use exercise prescriptions to help improve their health. And Carolyn has worked with me for a number of years, but recently returned after an absence. So I just wondered if you could tell us a little bit about what happened.
Sure. We are talking today in May 2022. In April 2019, I had a heart attack, ultimately transferred to Edinburgh, and a few days later had a triple bypass. So that's 3 of the arteries were replaced. Yeah, which of course they consider to be part of every day. I get the feeling that each surgeon that was doing it that day probably did about 3 or 4 of them.
Yes,
they do it all the time, but it's a huge event for us.
Yes, of course. And so once this fantastic work had been done, there comes a long road back to recovery. So can you tell me a little bit more about that? You had been fit before, but had you been recommended to exercise by a medical professional during that time or after the surgery?
It's not really quite as sort of straight a road as that, I don't get the feeling. There was no real discussion when I was still in hospital, recovering and looking towards leaving the hospital. And you are in contact with cardiac nurses when you first go home who say, oh, yes, you'll hear from rehab in a few days, few weeks, whatever. And you do get signed up for that. But to be frank, having done exercise for a long period of time before my incident, and having done cardio programs with you, the exercise regime that we're given at rehab doesn't even equate to our warm-ups.
Okay.
Now that's where the big problem started to strike, was that for many people that were attending rehab, that was almost too much. These were people that in many cases have never done any exercise, already had mobility problems. For me, I'm sort of saying to them, but when do I get to do more than this? For instance, during the time I was attending, and I think it's 5 weeks that you're entitled to, might be 6 weeks, the physios were having a challenge among themselves and with one of the other hospitals to do planks and to hold a plank. And I just watched them and I said, when do I get to do it? I can do a plank. When do I get to do one? And they all kind of went, don't really know. Because most people that were watching them were going, good grief, there's no way I'm doing that, and backing off and just going back to walking around in a circle. And I think an awful lot of it is not geared up for people who were fit. It's geared up for people who have never exercised and who are needing to be encouraged to take up this concept. And therefore they're trying not to make it scary. They're trying not to suggest too much to them. And I'm now getting more and more feedback, the more research and contacts I make, that this is one of the big issues, that those of us who have been exercisers, who were relatively fit, are saying, well, what do I do? Where do I go? How do I progress on? And the biggest thing I think they hear from us is, but I want to go back to how I was. I want to do what I was doing. And they're not really very sure how to get you there.
What kind of advice would you use for anybody who wants to use exercise as a health treatment, who's been in the same situation as you?
I think if people have been able to attend a support group for heart, for anything, cancer, rheumatism, whatever, I think the first place to start is talking to other people that have been through it and who can either say to you, I've got a great exercise coach, I've got a great Pilates teacher, I've got a great yoga teacher, whatever. Try them, they'll listen, they understand, they'll talk to you, is probably, like so many things, the best place to start. Find somebody who is being referred to you as being good, who's an understanding person. If you're lucky enough to have a consultant who is available and engaged, then it's worth asking them. But to be perfectly honest, when I spoke to mine, and he's very good and he's very encouraging, but he looked absolutely blank when I said, well, I really need to take this rehab further. I need to take it to the next stage. You know, we've got me mobile. I can do all the basics. I want to start getting back to proper exercise. I want to get back to being fit. At which point he looked blank, said, I'll see what I can find. And the answer is not a lot. The number of medics that walked into my bay and just took one look at me and went, what are you doing having a heart attack? You look so fit. And I don't know whether there was an instant assumption always that therefore somehow or other I would instinctively know how to become fit again.
So this is something that that your health professional, your activity professional does understand. Hopefully most exercise referral programs will provide around 12 weeks of that once you've gone through the cardiac rehab system. And while there may be changes depending on funding and budgets, that's the general protocol for post-surgery, or if somebody's going for an exercise referral for any activity that they want to resume after having had a serious health issue. What's the long-term prognosis for you then? What do you expect to happen now?
As far as I understand, the NHS are fairly uninterested in me. The only checkups I have are because I ultimately had to have a pacemaker fitted as well. And it's more of a mechanical thing. It's you come in so they can check the pacemaker is still functioning. They check that the battery has still got enough lifespan in it, and they just run a few checks on it more than anything else. It's not really a health check on me.
What percentage of back to your old self would you say you're at just now?
That's a really, really tough one. I'd like to sort of think maybe 70, 75%. I know that I'm not doing the level of weight training that I did before. I'm nowhere near the level I was doing before. And I would ideally like to get back to that, being very conscious of the importance of some sort of weight training for good bone health and everything, especially in women, and especially in menopausal women. And I think that's what I'm struggling with most, finding a way to integrate that safely and somewhere that a gym or a trainer are comfortable working with me. And I think, like so many things in our lives, it is psychological. There are days where I can do something and I suddenly think, wow, I just did that and didn't even think about it. Isn't that fantastic? And then there's other days I will have already overthought something before I kind of get my foot out of the car and go for my walk kind of thing. And you know, we're all like that anyway. You know what it's like, everything impacts you. So there are days when I'm really chuffed at how well I'm doing and how I'm not even overthinking any longer. And then there's other days where I'm kind of plunged back into the gloom of thinking, I'm never going to be fit again. It's terrible. That's life.
I think that's a very ambivalent place to leave it, but it's also pretty much, you're right, that is life.
Yeah, it is.
That's great. Thank you so much for your time and your honesty today. That was just wonderful. Brilliant. Thank you.
Thanks, Susie.